Thanks for this. So I'll tell you my understanding of how ADHD is related to trauma. Many people with ADHD have experienced trauma. Trauma will exacerbate ADHD symptoms. Having ADHD increases the risk of developing post-traumatic stress disorder when you experience trauma. One of the reasons is that people with ADHD have experienced more adverse childhood experiences. We call this ACEs, and this puts them more at risk. Other research has suggested that another reason for this is that they are genetically, there's a genetic link to ADHD and the genetic predisposition that some people have to develop post-traumatic stress disorder. So some people are more likely to develop PTSD when they experience trauma, and some people are not. And it looks like people with ADHD share that genetic predisposition to develop PTSD. So recent research also suggests that the longer diagnosis and treatment supports are delayed for children who have ADHD, the more likely they are to experience trauma. So that translates into girls, because we know girls are less likely to get accurate diagnosis and treatment provision. So some of the symptom overlap: anxiety, exaggerated startle response, executive functioning deficits, hyperarousal, hypervigilance, irritability, sleep issues, sleep disorders, problems with attention, impulsive and reactive behavior. So far that's what we know about the connection. This is far from causal. So I'm not sure if that's what you meant to be saying with this question. ADHD is highly genetic, so much so that, if a child has ADHD, people should be screening parents for ADHD. We know parenting, diet, video games, poverty, and stress don't cause ADHD. So there have been some causes that have been postulated that are possible causes that increase the risk of ADHD that have to do with things that expose the brain's development to damage in utero, such as hypoxia, lead exposure, and pesticides.